So today I'm going to show you several assessments that you can do on your patient. Now I'm going to start with showing you how to check for PERLA. PERLA is an abbreviation for pupils equal, round, reactive to light, and accommodation. Now in bright lights, pupils are about 2 to 4 millimeters, and in dark spaces, they're 4 to 8. So what we're going to do to check for this, we're going to stand about 12 to 15 inches away from our patient. We're going to let them know what we're going to do. So I'm going to shine a light in this side and then in this side, okay? Okay, so both of her pupils, they are equal in size, they're round, and they're reactive to light. And what we mean by reactive to light is that they are constricting with the light. Now, if I shine the light on this eye and this pupil constricts, that's called direct constriction. But if this pupil also constricts, that's called consensual constriction, and that's what you want to see. And then for accommodation, how we check for that, I'm gonna have my finger out here. I'm gonna bring it closer to you, and as I do, I want you to just focus on my finger. So focus, 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 focus. Okay, perfect. With this, we are looking for two things. One is convergence. That just means that as the object gets closer to her, her eyes turn inward to look at that object. The second thing that we want to see is that the pupils constrict, and that's accommodation. So for example, if we're looking at something that's far distance, our pupils dilate or get bigger in order to see that. But if we're reading or looking at something close up, our pupils constrict or get smaller in order to see that. All right, so next I'm gonna look at your ear. So I'm going to do that. Oh, it doesn't want to stay. Okay, so the first thing we're gonna do is we're just gonna look and see if we notice any bruising, any lesions, atypical moles, anything like that. So I don't see that. And then I'm just gonna touch around your ear, okay? Okay. So I'm just gonna be gentle with that earring. Down here. Any tenderness there?
No.
Okay. So next, I'm gonna get this, use my otoscope. Well, if it will stay on. Okay, I'm gonna pull up and back. I'm gonna look in here. Okay. So with this, what we are looking for is the tympanic membrane and the external auditory canal. With the tympanic membrane, it should be pearly gray. You don't want to see any redness, air bubbles, air pockets, or bulging. With the external auditory canal, it should be mostly clear and not inflamed. Now, if there's some cerumen, that's fine, but if you see anything that looks fuzzy, that could indicate a fungal ear infection, and you would want to follow up on that. All right, so I am going to get another one of these. And next, I'm going to show you an exam on the nose. So with this, there's a light source, and if you'll just kind of tilt your head, okay. So we're going to look in, and if you have a nasal speculum, you can use that to just kind of lift up, but if you don't have that, you can just gently take, if this will stay on, gently take this and lift up. Okay, and with this, what we're looking at, we're trying to see if there's any nasal polyps, any bleeding, any lesions, and we're also looking at the turbinates to assess for allergies or infection. So everything looks good on that. And then next, I'm going to touch right here. So we're just going to palpate the frontal sinuses. Okay, and next I'm going to touch down here. Okay, any tenderness there? Or up here? Okay, so if there were tenderness there, that could indicate a sinus infection or some severe allergies. Okay, thank you very much.
Thank you.